Hey, good morning. Happy Thursday. Hope everybody's doing well. You have your coffee in your hand? This is Coffee with a Doctor this morning. We're going to talk about what you can do about lower back pain that you experience at home. If you've had a recent bout or you're going through a bout of lower back pain, what can you do about it, right? We're not going to talk about the fact that we do laser and adjustments and things here. What we're going to do is talk about what you can do. Now, who am I to give you ideas about that? So if we haven't met, I'm Dr. Timothy Harcourt. I'm a third generation chiropractic physician. I've been practicing for 33 years. So welcome to the show this morning. We really are glad that you joined us. And if you're on rebroadcast, that's fine too. Hey, listen, if you have any comments, don't forget to put them in there for us. We like to follow what you want us to review on these sessions. So that's why we're going over what we're going over this morning. So really it comes down to what you can do for your back pain, right? So I have a couple questions for you. Did it recently occur, or has it been going on for a long period of time? And have you had it before, right? So is it a recent onset? And by recent, we're saying in the last 1 to 2 days. Now, listen, if you're 8 out of the 10 people that have no idea why their back's killing them, then obviously you're in good company. It doesn't help your back at all, but you're in good company. Like 8 out of 10 people that come in here have no idea why their back's killing them, right? So you can't always pin a particular event on your back pain. And the reason for that is your back pain typically is not from one event. It's from numerous things. Let's face it, we're a function of everything that's ever happened to us in our lifetime. Hey, maybe you worked on the farm, when you were younger, lifting things heavier than you were. Maybe not the best thing for your back, right? It's a good way to sleep at night, but sometimes it can be very difficult on the back. The thing is it a recent onset? Now, the studies show that if it's recent and you haven't had it before, there's a good likelihood that you're going to be able to get rid of that back pain. In fact, there's a certain percentage of patients that will get rid of it even if they do nothing, because your body has an inherent ability to heal itself. Is that pretty cool or what? So we have 75 trillion cells replicating at the rate of 25 million times a second. Hard to wrap our brain around those numbers. So we're not going to talk about numbers, right? Let's just say that if you had a car that could repair itself, put new rubber on the tires, fix the carburetor, clean the carburetor out, tune itself, that's kind of what your body's like. So the numbers are in your favor if you've had a recent bout of lower back pain. You may be able to deal with it and you might not even need any help at all. Okay, but what are some considerations for things for you to do? So usually when it's a rapid onset, there's an inflammatory component involved. And I do have to tell you that there's this legal waiver I have to do, but these are not, this session's not intended to make a diagnosis for you. It's not intended to give you treatment advice. You need to see your healthcare provider for that. Now, if you're in Fort Myers and you need help, by all means, come see me. But if you're somewhere else and you need help, go see a good chiropractor. And on other shows, I've said, hey, listen, if you need a referral for an excellent chiropractor, I'm happy to do that. Or you can go directly to the IANM website and put in your town and then put how many miles you're willing to drive, and it'll bring the doctors up that are board certified in neuromusculoskeletal medicine. So that's a great place to start. The other place to start is with a referral from your friends and family members of people that you know are very good. That's a great place to start too. So anyway, back to treating your own back pain. So if it has an inflammatory component, you are probably going to want to use ice and not heat. Why is that? Well, when your body is swollen, if you heat it up, you're going to create more swelling. So think about this for a second. If you sprained your ankle, does it get smaller or larger? It gets larger. The reason it gets larger is because you just sprained the ligaments that hold that joint together. And most likely anterior fibular ligament if it's of an inversion sprain. But the point is this. If it creates an inflammatory component in your ankle, the last thing you want to do is put that ankle in a hot bucket of water, because you may end up making it 3 times its normal size. That's normally not a good idea in the body, and especially not around the spine. The spine has limited room for nerves to traverse, so you don't really want to create extra pressure. It's like sitting an elephant on top of your nerve. Doesn't make a lot of sense. In fact, it only takes 25 millimeters of pressure on a nerve to reduce the translation of electrical energy by 50%. 25 millimeters of pressure is next to nothing. It's the weight of a quarter. So, you don't really want to add a lot of external pressure on your back. It's a good way to wake up and not be able to move. And we have people coming into the practice like that. What did you do last night? Well, I slept with the heating pad on my back all night long. Probably not a good move, especially with acute back pain, because there's an inflammatory component 9 out of 10 times, maybe even higher than that. So anyway, that would be your first consideration. Do you have radiating pain? Now, when I say radiating, does what we're not talking about, does it, we're talking about going down your arm or your leg into your hand or your foot. That's what radiating pain is. Now, radiating pain strongly indicates the possibility of a pinched nerve. And that's where the truck sitting on the garden hose in the driveway need to back the truck off the garden hose. Okay. Now, even if you do back it off, that garden hose could remain pinched for a while or crimped, right? And that crimping, that bruising of the nerve is what causes latent pain in the extremity, even if you take the pressure off of it. But you definitely want to back the truck off the garden hose. So why did it get pinched to begin with? What were you doing? It's like the old story. Somebody comes in and says, "Doc, every time I do this, it hurts like crazy." And my response is, "Well, why don't you stop doing that?" Right? So anyway, not trying to make light of it, because actually many of the patients that come in, it's because of something they do for a living. So I was in construction before I was a chiropractor, and I did all kinds of things to my back that probably shouldn't have, but you got to make a living and do what you got to do, right? So, but we can be smart with what we're doing. So that's the point. That's the whole point of it. So if you find yourself having that same back pain every single time you do something at work or what have you, then you may need to switch jobs or something like that, or just switch how you're doing it, because there's a smarter way and a harder way. So what we're saying is, don't work harder, work smarter. But anyway, if you know of the reason, so you would be at the minority, because most people that come in don't really know why their back's hurting. Now, there's an exception to that rule. Somebody who's in a car accident, their neck and back's hurting, then that obviously there's a reason why it's hurting at that point in time. It was traumatic, or some of the sports injuries, somebody got hurt on the field or what have you. So those are different scenarios. But the typical person coming in with back pain that's not injury related, they really don't know why their back is hurting currently. Let's talk about, has this been in existence for a long period of time? It could be even intermittent. In other words, you've had back pain intermittent for 30 years. It goes away for a while. Then it comes back, and then it goes away for a while. And if you're saying to yourself, this is getting more and more frequent. In fact, I have back pain more than I have no pain. You can start to feel the tunnel closing in on you at that point in time. So obviously, Einstein said the definition of insanity is doing the same thing and expecting a different result. So at that point in time, you may want to try something different. So remedies at home, like what can you do at home to help yourself? So we're just going to start with the ice. So our ice application instructions recommend application of ice with a barrier. So we're talking a paper towel or a t-shirt, so that you do not put the gel pack, or even if you use a Ziploc bag with ice in it and then put some water in there, that actually makes a great gel pack, by the way. As long as you get a Ziploc that doesn't leak. I mean, it's quite messy, If you're laying in bed with the Ziploc bag leaking all over your bed, but if you can, and you can test that before you take it in, just got to make sure you're not moving the little tag on the top, the little lock. So, so with a barrier for 15 to 20 minutes directly over the area of the back where it hurts. And then patients ask, well, listen, it's hurting down my leg. Why wouldn't I put it on my leg? Well, because the nerve gets pinched almost always at the back level, not in the leg. There are exceptions where nerves, peripheral nerves, especially the sciatic nerve, can get pinched in the butt. But you probably want to put the pack on the back. And if you have sciatic at the same time, you can kind of split the difference between the butt and the back, right? Because this one picture here where it shows a circle around the hip, that's different than a piriformis problem, but that's very close to where that nerve gets pinched. So, the thing is, you could go halfway between the back and the buttock. Well, depending on how big your gel pack is, you might be able to do both. We have gel packs that'll cover both areas all at once. People ask, well, how long does it take when you put a gel pack in the freezer for it to get cold enough to put on your back that it'll make a difference? We find about 3 to 4 hours. So like if you've had that at room temperature, you're looking at least 3 to 4 hours for that gel pack to cool down to a temperature that's going to be beneficial for you. Now, if you put it on for 15 or 20 minutes, people ask, how long does it take to cool it down to put it back on? So it's not going to take as long, because you're not going to just let that gel pack sit out at room temperature. You got to put it right back in the freezer. Now it might only take an hour or two to get back down to temperature for you. And we never recommend putting ice on continuously. And the reason for that is because you want the blood to come back into your back, into your muscles, tendons, ligaments, and nerves. But when you are putting the ice on, it drives the blood out of the area. So it does reduce the fluid in the area. That's what you want it to do. But you don't want to starve the tissue. So we usually say 15 to 20 minutes on, an hour off, 15 to 20 minutes on, an hour off. So that hour off allows for revascularization of the area, to clean out the pyruvic and lactic acids that are building up, to help the blood pump away the inflammatory components. That's why you want a break in between. You don't want to keep putting ice on continuously. Now, patients do ask, I put heat on and it feels good. Why shouldn't I keep doing that? So this is my answer to that question. If you put heat on, now, if it's an acute back problem, you're just basically fooling yourself. If you put heat on that, it's not going to work out too well for you. Okay. You just recently, like a few hours ago, strained your back and you're going to put heat on it. That's a bad move, most likely. If you've had, say, long-standing back pain and there's no recent aggravation or injury, but your back hurts, and then you put the heat on and it gives you relief, that's a little bit different. I mean, because there's probably not a significant acute inflammatory component. You could have something like interleukin 6, which is chronic inflammatory cytokine that's in your joints causing the pain. So in that case, you could put heat on it for a short duration, not all night long. I mean, come on. On ESPN, they say, come on, man. I mean, that's what I would say about putting heat on all night long. Come on, man. Just like getting in a hot tub. You don't get in a hot tub for 2 hours straight. It's just, come on, man, don't do that. So as far as the heat, you can put it on 15 or 20 minutes, maybe 30 at max, and then give yourself a break. Now, this is the question you ask yourself. Do I feel better 2 hours later? If the answer is yes, then you can repeat that. But if the answer is, I felt good for 15 or 20 minutes after I took the hot pack off, but then it started feeling worse again, do not repeat that process, because you have an inflammatory component and you're adding to it with the heat. Now, people ask, what if I have this long-standing back pain that I put heat on it, it feels good, but it just keeps coming back? well, you might want to consider something that will moderate or reduce interleukin 6, the cytokine interleukin 6 in your body, but taking a CBD product, a non-THC CBD. You do not need the THC in there to reduce the inflammatory component. Plus, why would you want to go down the road of being addicted to something? So what we sell here is a non-THC CBD, and that helps to reduce that chronic inflammatory component. And it's not only in your back. If you look at the pictures here, it can help your hip, your knee, your elbow. It really doesn't matter which joint it is in your body. It'll help reduce that. So for those patients that are considering getting a knee replacement or hip replacement, I would say you have nothing to lose by doing the CBD, unless you have a contraindication, which there aren't that many. But if you did, then don't do it. But you could try the CBD first. You could also do other joint support products. And, you know, after that, omega-3 is another good one. So you try all that stuff and, you know, you can't stand the joint, then maybe you do need to get a replacement surgery. But if it were me, I would try everything I could naturally first. So what are some of the other remedies? If you go on our website, or you go on the internet for that matter, and just put in back exercises, there's a ton of exercises on there. We have them on our website and on our YouTube as well. But one universal stretch, which seems to help people, I mean, there's a million different exercises to do. Let's face it. I mean, you basically fall asleep looking at all the exercises on the internet. But if I were to look at one in 33 years of practice that generally seems to give patients relief of their back pain, it's on your back, in your bed, or on a soft carpet or mat, and you pull your knees up to your chest for a count of 5. You do one side first, the other side for a second, and then both at the same time. Always finish with both knees towards your chest at the same time. They're called kneaded chest stretches. Now, it's not an active exercise. It's just attempting to decompress the nerve roots of the lower back and the facet joints. So many times, if, like for instance, if you've had a long day and your back is hurting, but you didn't strain it or sprain it, then kneaded chest stretches will most likely help you. And then in that case, if there was no injury, then the heat actually might help you. So you could get in the hot tub for about 10 minutes. Not 2 hours, you know, 10 minutes, or you could put the heating pad on there for maybe 30 minutes. And you ask, well, why do I only need 10 minutes in the hot tub and 30 minutes with the heating pad? Well, hot tubs will transmit the heat to your inside your body much faster because of the convection involved with the water molecules spinning around your back. Whereas with the heating pad, it's simply conduction. It's moving the heat from the pad to your back, but there's no increase and transfer from the molecules moving all around like it does in a hot tub. So that's why there's a difference in the time, right? Now, listen, let's just say, and by the way, if you know of somebody that has back pain and they need to see this, go ahead and tag them on this, you know, let them know about it. It doesn't matter where they live, you know, it can help them out. But let's just say that you've done all the remedies and you're at wit's end and you know that you need help. Well, you know what? That's the time to pick up and call your local chiropractor, and hopefully you pick a board certified chiropractor in neuromusculoskeletal medicine. You can go, like I said, on the internet and look that up, the IANM website. For the month of September, just a little plug here, we're doing exam and first treatment on us. So, you know, that's something that, you know, rarely ever happens. But we know that there's people out there that need help, and we're here to help you. And by the way, we don't turn anybody away here. So if you know you're having tough times and you need treatment, come on in. We're going to take care of you. So anyway, I hope that there's something that you gleaned out of this session today. You know, we're here reaching out to you to try to help you in your life. So give us other comments on things of other topics you would like to hear about that'll help you. That's what we're here for. We're meeting you where you're at and helping you get where you want to be. Don't forget to stay healthy, stay strong, and whatever you do, stay creative. Make something that did not exist in your life when you woke up this morning. Great to share some time with you. Dr. Harcourt signing out. Have a great week.